Pancreatic failure doesn't start with pain. It starts with symptoms you're ignoring. It usually doesn't start with pain. It starts after a normal meal. You're bloated, tired, maybe a little nauseous. You tell yourself you ate too much, or it was just something greasy. But what's really happening is your pancreas is struggling to keep up.
The pancreas doesn't fail overnight, but early support can slow decline, preserve function, and change the path people end up on. That's the premise.
And you don't feel that until it's already behind. That's the danger. Your pancreas works every single day to control digestion and blood sugar. And when it fails, the consequences aren't temporary. They're permanent. Why this matters. The pancreas has two critical jobs. First, it produces digestive enzymes that break down fats, proteins, and carbohydrates so your body can absorb nutrients. Second, it releases insulin to regulate blood sugar and energy use. When either system begins to fail, the fallout is serious. Chronic inflammation, digestive dysfunction, blood sugar swings, insulin resistance, diabetes, and this isn't rare. Hundreds of thousands of people are hospitalized every year with pancreatitis, not because they ignored pain, but because the damage started quietly. Here's the part most people never hear by the time pancreatic disease is obvious. The damage is usually already done.
When pancreatic enzymes drop, food stops becoming fuel. That's when bloating, fatigue, and nutrient loss become daily problems, no matter how clean you eat.
Pancreatic beta cells do not regenerate easily. Lost digestive enzyme function does not simply come back. Once insulin resistance hardens into diabetes, you're no longer preventing disease. You're managing consequences. This is why people say, I wish I had known sooner. Because once you're chasing blood sugar numbers, taking enzymes with every meal, or recovering from pancreatitis, the window for true prevention has already closed.
Pain is not the warning sign. Pain is what shows up after pancreatic function has already been lost. And that loss is hard to reverse.
What you're hearing today is what most people only learn after the diagnosis. Who this is, for if this describes you, this video matters. If you feel bloated after meals, if your blood sugar keeps creeping up, if diabetes runs in your family, or if you're trying to avoid medication escalation. This is where prevention still works.
Most pancreatic damage doesn't happen during emergencies. It happens silently, over years, while people are told everything is fine.
Quick clarification. These supplements are not cures. They do not regrow a damaged pancreas. They do not replace insulin. They do not replace digestive enzymes. What they do is reduce inflammation, lower insulin demand, and protect remaining function. That distinction matters.
These compounds don't heal a damaged pancreas. They reduce inflammation, improve signaling, and slow the damage that leads people to lifelong medication.
Supplement 1. Turmeric. Turmeric is not just a spice. Its active compound, curcumin, directly targets inflammation. Inflammation is one of the biggest drivers of pancreatic damage. Curcumin calms inflammatory pathways that actively destroy pancreatic tissue. It also acts as a powerful antioxidant, protecting insulin-producing beta cells from oxidative stress. Once those cells are gone, they do not come back easily. Curcumin is poorly absorbed on its own. Black pepper contains piperine, which increases absorption by up to 2,000%. Without it, most curcumin is wasted. Used correctly, turmeric lowers the daily inflammatory load placed on the pancreas. Supplement 2. Ginseng. Next is Panax ginseng. Ginseng does not force insulin release. It helps your body use insulin more efficiently. That matters because insulin resistance forces the pancreas to overwork. Over time, that leads to burnout of insulin-producing cells. Ginseng contains compounds called ginsenosides. They improve insulin sensitivity, reduce oxidative stress, and help protect beta cells. Human studies show modest but meaningful improvements in blood sugar control. Ginseng can lower blood sugar. If you take diabetes medications, medical guidance is essential. Cinnamon. Cinnamon works quietly. It slows carbohydrate digestion. That prevents sharp blood sugar spikes after meals. Less spike means less insulin demand. Less insulin demand means less strain on the pancreas. Cinnamon also improves insulin receptor signaling, helping glucose move into cells more efficiently. Human studies consistently show lower fasting blood sugar and improved insulin sensitivity. For regular use, Ceylon cinnamon is preferred. Cassia cinnamon contains coumarin, which can stress the liver at high doses. Supplement 4. Fenugreek. Fenugreek works upstream. It is rich in soluble fiber, which slows glucose absorption in the gut. That reduces how much sugar ever reaches the bloodstream. Fenugreek also contains 4-hydroxyisoleucine. This compound stimulates insulin release only when glucose is present. That supports insulin response without forcing unnecessary release. Animal studies suggest fenugreek may also protect pancreatic cells from toxic damage. Because fenugreek can significantly lower blood sugar, anyone on glucose-lowering medication should use medical guidance. Supplement 5. Bitter melon. Bitter melon is powerful. It contains plant compounds that act like insulin at the cellular level. It improves glucose uptake, reduces circulating blood sugar, and alters glucose metabolism. In animal studies, bitter melon disrupted glucose metabolism in pancreatic cancer cells. This does not mean it treats cancer. It shows how deeply metabolic pathways influence disease. Because bitter melon is potent, it must be used cautiously. Avoid during pregnancy. Consult a healthcare professional if you have diabetes or take medications. Lifestyle anchor. Supplements do not work in isolation. They work best when insulin spikes are lower, inflammation is reduced, and meals are predictable. That means fewer refined carbohydrates, adequate protein, and consistent meal timing. That foundation makes everything else work better. Part 2. Most people focus on blood sugar. Very few people understand pancreatic enzymes. In Part 2, we're going deeper. We're breaking down the specific pancreatic enzymes your body depends on to digest food properly. Lipase, amylase, protease. What happens when they start dropping? Why meals leave you bloated? Why nutrients stop absorbing? And why eating more doesn't fix the problem. We'll also cover which supplements actually support pancreatic enzyme function, which ones are overhyped, and when enzyme support makes sense. If you want to understand what your pancreas is really doing after you eat, make sure you're subscribed and watch for Part 2. Medical disclaimer. This video is for education and information only. It is not medical advice and not a substitute for care from a licensed healthcare professional. If you have pancreatitis, diabetes, or take prescription medications, talk to your healthcare provider before using supplements. Do not self-treat serious medical conditions. Final takeaway. The pancreas does not fail suddenly. It fails quietly, gradually, under constant metabolic pressure. These supplements do not cure disease. They reduce inflammation, stabilize blood sugar, and lower pancreatic workload. Your pancreas is working for you right now. The question is, are you working for it? This is healing. This is resilience. This is alternative medical care.